Begin with the healthcare battle that has been consuming all here in Washington, and especially that liberal revolt we've been seeing. We're joined by a Democratic congressman from New York City. Jerry Nadler joins us from New York. Thank you so much, Congressman, for being with us.
It's a pleasure.
I want to begin by saying we saw Rahm Emanuel in the New York Times today quoted saying, listen, the Republicans have clearly decided that they want to torpedo healthcare to hurt the president politically, no matter what. They'd rather not get it done. Isn't the liberal left of the Democratic Party doing the same thing on this public option, that they would rather just not get something done if it doesn't include a public option?
Well, we want to have a good bill, but without a public option, there can be no good bill, because we will have a bill that will do a lot of very good things, but at the cost of throwing huge amounts, multi-hundreds of billions of dollars at the insurance companies with no real cost controls. It will be unsustainable. It's only the public option that will keep the costs under control and as the president says, keep the insurance companies honest. But I have to put it into a little more context. It's not a liberal revolt. It's the conservatives who revolted. Because remember, the president campaigned last year on a public option that would be open to everybody. We've already compromised repeatedly. First, we compromised by saying, all right, we won't do a single-payer plan, we'll do a public option. Then we compromised by saying, all right, the public option won't be open to everybody. It won't be open to people who get health care through their employers. It'll only be open to unemployed people or people whose employers don't offer health insurance. Then we compromised by saying, all right, we won't base the reimbursement rates to doctors and hospitals on Medicare. And that's it. Now, obviously, the White House may have thought, or some people in the White House may have thought, that, all right, the House will pass a bill with a public option. The Senate, because we're not cracking down on the Senate, won't. The conference committee will come out with a bill, and the liberals will cave in. Well, we're not going to cave in. We will not vote. I will not vote, and many of us will not vote for a final House-Senate compromise without a public option in it, because we're not going to throw hundreds of billions of dollars at the insurance companies and enact a program that won't be unsustainable in the long run.
Congressman, what does the president need to be doing right now to try to drum up that support? Do you need him cracking down on the Senate? One other thing I've heard,
yes.
I'm interested in your take on this. Does he need a kind of bumper sticker slogan around this that he can say, look, we're going to lead the charge with this?
Well, I don't know if he needs a bumper sticker slogan, although there was a bumper sticker available. Medicare is a very, very popular program, and we should have just said Medicare for all. We're going to make Medicare available to everybody, not just to older people. And that would have been a single-payer system, but that's what a single-payer system is.
But that was never on the table. That was never on the table.
Well, it was never on the table because the president and various other people chose to take it off the table. We agreed to that. Maybe we shouldn't have, but that was the first compromise. But what the president needs to be doing now is saying to the Senate Democrats, look, we don't need 60 votes to pass the bill. We need 60 votes to stop a Republican filibuster. As a matter of controlling the floor, of showing that the Democrats control the chamber, everyone must vote for cloture over a filibuster, and then you can vote how you want on the bill, and there'll be more than 51 votes for the bill.
Congressman, I want to turn your attention to these heated town halls that we have seen throughout the country. A lot of angst in the American public about the details of this bill, sort of misunderstanding of certain things of this bill. And the rhetoric just gets more and more heated, including from you, sir, to the Huffington Post. I'm going to read you your quote here. You said, it is fascist. It is a fascist tactic in talking about these town halls. That's exactly what they did in Weimar, Germany. Let me put it this way. It is a fascist tactic not to disagree with you or to say you are an idiot or whatever, but to try to shut you up. That's what I mean. That's a fascist tactic. Do you really want to bring fascism into this debate? I mean, is that helping healthcare get to all Americans,
well,
sir?
Well, the people who are bringing fascism into the debate are the people who are using fascist tactics, not to disagree, but to keep members of Congress from explaining their positions to their constituents, and to keep their constituents from asking questions. If you want to go to a town hall meeting and ask hostile questions, skeptical questions, make very hostile remarks, that's your privilege. But if you want to go to a town hall meeting for the purpose of making sure that nobody can be heard, that it can't be discussed, that is a fascist tactic, and we ought to be labeling it for what it is. Now, I'm not saying that people who oppose health care are fascists, God forbid, I would never say that, but people whose aim it is to prevent discussion, they are using fascist tactics.
Congressman, when you see the way that this has played out over these last couple of weeks, do you feel like progress has been made in terms of making the case to the American people, making the case to the Congress that this has to happen?
I think that the opponents who bankrolled these tactics to shut up discussion achieved a large part of their purpose, because one of the things that people wanted to do was to fan out across the country, have Democratic members of Congress explain what was in the bill and what wasn't. There no death panels, none of this nonsense are in the bill, et cetera, and have people ask questions and have the local press report what they said and what the questions and answers were. And instead, what the press reports is this one stopped him from talking and that one had terrible tactics, and the disruptions became the news instead of the pros and cons and the facts of what we're debating. And so that was a success for people who didn't want the information to get out there. And it's unfortunate success because it shows that anti-democratic tactics have worked. Now I think that people are beginning to react against this and they're beginning to listen. And we're beginning to get more information about what is in the bill and about these lies that simply aren't in the bill. That this is not, for example, a government takeover of health care. CBO, right. the Congressional Budget Office, estimates that at the most, the number of people who will be in the public option in 10 years would be about 10 million, which is to say 3 to 4%. That's not a government takeover.
Congressman Jerry Nadler, Democrat of New York City, thank you so much for being here today. We greatly appreciate your time.
You're quite welcome.